In fact, Public Protector Advocate Zweli Mkhize has initiated contempt proceedings against Mkhize, who's failed on 3 occasions to honor a subpoena for her investigation into a complaint that was laid by the Clinical Association's National Task Team. So this association, they want the Department of Health to look into key issues impacting clinical associates, a relatively new profession in the healthcare sector itself. These associates assist doctors in providing care to patients but haven't been empowered to do their work, resulting in disillusionment by some within the profession itself. So what's the way forward looking like? Let's bring in Sanele Ngcobo. He's the Secretary General of the Professional Association of Clinical Associates and joins us now via our video link to ventilate his frustrations. Sanele, thanks for your time. It's great to have you on the program. I don't want to take it for granted that everybody really understands what clinical associates do. So perhaps let's begin there. Help us understand the mandate that is given to the Professional Association of Clinical Associates, and then go on to give us a sense of what you want from the Minister.
Thank you very much, Ayanda, for hosting us today. Maybe just to say that clinical associates, this is still quite a new profession in South Africa, introduced around 2008. So what clinical associates actually do is that they perform tasks and activities related to diagnosing patients, taking history, managing common conditions, and preventing different conditions. So clinical associates have skills and knowledge to do all these different activities. So this profession, when it was introduced, the main aim was to bridge the gap in our healthcare system, because what we realized was that the burden of diseases was growing at at an alarming rate. But then we experienced a huge shortage of healthcare workers in general and doctors in particular. So in order to deal with this particular issue, the Department of Health decided to introduce this particular profession. They are currently trained in 3 universities, University of Pretoria, Wits University, and also at the Waterstones University. And then when they qualify, clinical associate get what we call a bachelor of clinical medical practice. So this is a degree which they get over a period of 3 years.
So at the center of what the Public Protector has now done is a report by the Clinical Associates National Task Team. Help us understand what initiated the establishment of this task team and what this report wanted from Mkhize.
Yeah, so when the profession was introduced, there were many issues which were never addressed properly. So the Department of Health, through its own diagnosis, realized that these challenges needed to be ventilated, and to invite all the different stakeholders to come on board, sit down and try and address all those issues. Now, when they did that, then they formed what they call a National Task Team on Clinical Associates. So when they formed this National Task Team, it included the Provincial Departments of Health, the National Department of Health, the HPCSA, the universities, and then the aim was to try now and address all the different challenges faced by clinical associates. These include issues such as the prescription rights, issues such as the job evaluation, which in our view, it was never done properly as it was supposed to be done. The issues of remuneration, the issues of OSD, overtime, and royal allowances. So all those issues were ventilated within that particular National Task Team report. But when then this report was supposed to be implemented, when the recommendations of this report were supposed to be implemented, the Department of Health never came on board to implement those. So at the center of our frustration is that here is a team, or here is a group of fairly young professionals who are willing to help and assist in terms of dealing with challenges faced by our healthcare system. These are professionals. They have been trained. Most of them, or some of them, have been recruited from disadvantaged areas, and they are working in disadvantaged areas such as in the rural areas. But there are no opportunities for clinical associates. They are not given a space to work and to do their activities with the same way other professionals are allowed to do their activities. So we have seen that some of clinical associates, through the frustrations and through the challenges that they face on a daily basis, they've started even experiencing mental health issues because of the challenges which they are facing. And we're saying we want to send a very strong message that we are young, we are ready to contribute in fixing what some call as an almost collapsing healthcare system. But we need the Department of Health to work with us. Let them come on board and listen to us and address all the issues which we are raising to them.
Right. The establishment of the clinical associates, as you mentioned, dates back, I think it's about a decade now. And just from my own count, that must have meant that 3 health ministers have been in place since the clinical associates have been operational. Between Mantu Shabalala Msimang, Dr. Aaron Motsoaledi, and now Dr. Zweli Mkhize, which of those political heads did anything to address some of those concerns, if anything at all?
That's a very important question. So, Dr. Mantu Shabalala Msimang is the one who was behind introducing this particular profession. So she had a very good vision because she clearly understood the challenges which are faced by our healthcare system. And she said that we cannot re-engineer our healthcare system without fixing the challenges faced specifically by the shortage of healthcare workers. So what she then did was that she started the profession. She introduced the concept. So then the Minister of Health, the former Minister of Health, Dr. Aaron Motsoaledi, came on board around 2009. He was then supposed to start implementing this and making sure that he absorbed clinical associates into the system. He started quite very well around 2010. We remember he was there in Waterloo University when clinical associate graduated. So we were happy with that. But at some point in time, he just dropped the ball. He just couldn't assist us as clinical associates to function effectively. So we have on numerous occasions wrote letters to the National Department of Health, went to Parliament, went to Public Service Commission, went to many different departments asking for help, saying that we needed to be assisted. But Minister of Health at that time was unable to assist us. So when Dr. Zweli Mkhize came on board, already it was about 8 or so years after this profession was introduced. Unfortunately, in the period when we were trying to engage with him, unfortunately, COVID-19 came and he was disrupted. He then focused on COVID-19. So we haven't really had a very good or a very strong communication with him, mostly because of issues such as COVID-19. But he was then also given an opportunity to come on board by the Office of the Public Protector to come and respond to these allegations and the issues which are faced by clinical associates. No, he then was then given 3 different opportunities to come and account and say, why are clinical associates not absorbed in the healthcare system, which is in desperate need of these quite very skilled healthcare workers? Unfortunately, for some reason, and we are failing to understand this reason, why would the minister decide not to come and account? Unfortunately, he did not come and account on many of these issues. So now our main issue is for our issues to be addressed.
Sure. What happens in the interim, Sanele? Because my understanding is that part of what you need the minister to do is also to give job evaluations, because there isn't a scope of practice, which means people are pitching up and quite frankly don't know what they can and can't do. So what do they do?
Yeah, but so there is actually a scope of practice, even though there might be things which we don't agree with that particular scope of practice. So, but what we are asking for is that we sit down with all the relevant stakeholders. This includes the National Department of Health, this includes the HPCSA, SAPRA, and all the other different stakeholders. We come together and we go through the work which has already been done, because there's massive work which has already been done. There is a task team report which is more than 100 pages, which speaks to all these different issues, even though it might miss some of the few issues. So now we are saying we want the National Department of Health to call all these relevant stakeholders, and we're saying this in good faith. We're saying we are young, we are prepared to help the healthcare system, which is almost collapsing. We are prepared to make sure it does function effectively. We are ready to move toward universal health coverage, but we need to be assisted by the National Department of Health and all relevant stakeholders to give us time and the ear and hear what are our challenges, and then we can together work together to make this healthcare system, which is desperately needed by our people, in particularly those who are in disadvantaged areas, in particularly patients who have to stand on queues for quite very long hours. We are saying it cannot be right that while there is a solution, but it's not utilized. we can come with any intervention into the healthcare system, but if we do not address the issue of the chronic shortage of healthcare workers, we're never going to get it right. So we're calling upon the Department of Health to urgently call all relevant stakeholders and work towards fixing the challenges faced by young and passionate clinical associates who are ready to contribute into the healthcare system.
Boggles the mind why young professionals will have to beg government to be included in the midst of a global health crisis. But I guess here we are. Thanks very much for your take on this. I imagine the health department will soon have to say something in response to that. Sanele Ngcobo is the General Secretary of the Professional Association of Clinical Associates. Thanks very much indeed once again.